Hello, acid reflux, GERD and hiatus hernia. This is the topic, the differences between these two. Most of the people think both are same, but most of the time the symptoms and signs most probably the same, but they are entirely different category of diseases, gastrointestinal diseases. So we all know we have a food pipe, stomach, and there is a junction. So the junction has a sphincter. This is a one-way sphincter. So when you have food, everything should go down. It should not come up. When the sphincter becomes loose and things come up, that's called acid reflux or GERD. So GERD is related to the function of a lower esophageal sphincter. The same thing, hiatus hernia. Hiatus hernia is nothing but usually we have a diaphragm. Diaphragm is the muscular structure that separates your chest and the abdomen, through which the food pipe goes, esophagus. So there is the hiatus. The hole is called hiatus. When the diaphragm is weak, the whole stomach can come up and go down. That's called hiatus hernia. So the GRD or the heartburn or acid reflux is functional. The hiatus hernia is structural problem. So and most of the time the signs and symptoms in GRD could be heartburn, dry cough, sticky food or something obstructing, breathing difficulty, chest pain kind of thing. And hiatus hernia most of the time can be without any signs and symptoms. But when it gives signs and symptoms, it is exactly almost like your GRD or the acid reflux. And when the hiatus hernia is too much, even sometimes the regurgitation is very high. Even the food can come through your nose. So these are the things. And the signs and symptoms for GRD like heartburn, sour taste, dry mouth, dry cough, especially after taking food or lying when you lie down, they have a this kind of cough. This is all mainly for the reflex. And diagnosis for the GRD or the acid reflux is, though endoscopy is very important, but we have a manometry, we have pH monitoring, and all these things can tell us the acid reflux part. But hiatus hernia mostly endoscopy or CT scan or the scan part. And the treatment wise, both will have the same, uh, first and foremost is lifestyle. Lifestyle is the best for both acid reflux as for the hiatus hernia. What is that? First, have a small 6 times meals, steam cooked food, avoid oily, fatty meal, and give at least 3 hours before your food and lying flat. And if you're obese, reduce your body weight and avoid citrus foods. All these things are both common. And stress, all these things should be taken care. The lifestyle is very important. 90% is lifestyle. And the medical part, like H2 blockers, ranitidine, or even PPIs, pantoprazole, rabiprazole, or even the latest vonoprazole. All these things are medical, and even antacids will be combined. But if the medical treatment fails, in spite of the lifestyle and the medical treatment, if it fails, then surgery, probably like a fundoplication or tightening the crura, all these things can be done. That will be decided by your doctor after the endoscopy. All the medical treatment fails, they may suggest surgery. Thank you.